Alright, team, listen up. We have a patient presenting with symptoms of viral cardiomyopathy, endocarditis, and balanitis circinata. What do you think we're dealing with here?
Based on those symptoms, it could be a tricky diagnosis. It might be viral in nature, but also related to a bacterial infection. Perhaps some sort of rare skin condition too.
I agree with Gary. It's definitely a complex case. The symptoms don't immediately point to a single diagnosis.
I'm leaning more towards an infectious cause, possibly endocarditis that's affecting the heart and causing systemic inflammation.
I think we should consider a more unusual condition, like hypohidrotic ectodermal dysplasia.
The symptoms could fit, although it's not a typical presentation.
Damn it. Listen up. It's hypohidrotic ectodermal dysplasia. I'm sure of it.
But sir, colectomy is a risky procedure. Are you sure it's the right call?
I don't care how risky it is. It's the only way to save the patient. We need to act fast. Time's ticking.
All right, let's prep for the colectomy. We'll make sure to monitor the patient closely during and after the surgery.
I'll coordinate with the surgical team to get everything ready. We can't afford any delays.
I'll review the patient's history again to see if there were any missed clues that could point to hypohidrotic ectodermal dysplasia.
Good. Let's save this patient's life, no matter the cost.
Hawks, please come in and have a seat. I heard you want to perform a colectomy on your patient with symptoms of hypohidrotic ectodermal dysplasia. Where did you get such a stupid idea?
I was just trying to explore all possible treatment options. I watched a 5-hour YouTube documentary about 3 doctors stranded on Antarctica who ate ice for 5 months before being rescued by a team of highly intelligent penguins.
Hawks, patients are not penguins. We have proper protocols to follow. We can't just go cutting things out based on whatever the fuck you watched last night.
You truly missed the point of the documentary. Those doctors survived on ice for 5 months and ended up creating an inseparable bond between each other.
Let me guess. They became frozen in one giant ice cube before these highly intelligent penguins melted it with their laser vision?
Don't be daft. They pulled a Dumb and Dumber like when they rode a motorcycle into Aspen, and the penguins freed them.
Why are we still talking about this? There's a patient whose survival is dependent on you saving them, not recapping a zero-budget documentary that was probably based off of some Reddit creepypasta.
Leslie, we have a problem. The patient is in critical condition.
Oh no, that's not good. What's going on?
It seems the colectomy was not the correct treatment for hypohidrotic ectodermal dysplasia. Hawks needs to know about this.
Let's focus on the patient first. We need to stabilize them before worrying about how to break the news to Hawks.
But we can't keep this from Hawks. We must inform him.
I understand, Frank. Let's prioritize the patient's well-being and then we can figure out the best way to handle the situation with Hawks.
What the hell were you thinking? You nearly killed our patient by choosing the wrong colectomy and the wrong diagnosis.
I still believe the issue lies in the gastrointestinal tract, Dr. Hawks.
No, I think it's more related to the cardiac system. The symptoms align more with a heart condition.
I agree with Leslie. The patient's history suggests a potential heart problem.
Actually, I think it's a neurological issue. The symptoms could be stemming from the brain.
You're all a bunch of incompetent fools.
Alright, go storm out of this room, Hawks. You're gonna figure this out while stuffing your face with cafeteria-grade Mediterranean eggplant sandwiches.
Bolts out of the room in hysterics.
So, team, did you see that documentary that Hawks was talking about?
See it? Randall and I were goofing around with an II program and wrote the entire documentary with it, then had AI generate the video. I'm surprised Hawks even found it.
He watched it instead of the hospital's mandatory annual training on team management. Somehow they never noticed.
It's not like the quiz after that is difficult. They just ask if you remembered the names of your teammates.
Why does it sound like you came up with the quiz, Gary?
I did. There was a survey asking us for suggestions, so I thought up of a good waste of Hawk's time so I could watch that documentary.
Jesus, I should probably just delete it. There's no way anyone would waste their time watching something so stupid.
So, Johnson, How's everything going in your personal life outside the hospital lately?
Oh, the usual. Busy with the kids, trying to find time for some hobbies. It's a juggling act, but I make it work.
You don't have kids.
Thanks, but what about you, Hawks? You've been pretty quiet today. Everything all right?
Actually, I've been thinking about a challenging medical case. It's been on my mind the entire lunch.
Oh, really? Did you spend all your time watching that YouTube documentary? The Antarctic icebreakers.
Ice breakers. I think I just had a breakthrough. It all makes sense now.
Wait, what do you mean? What did you figure out?
I have to go, Johnson. I need to check on my patient. Thanks for lunch.
Wait, you're leaving just like that. What about finishing your meal?
Sorry, but this can't wait. I'll catch up with you later. See you.
Well, I guess I'll finish eating alone then. Good luck with your patient, Hawks. God damn it, I hate that this hospital only has stale Mediterranean sandwiches. Munch, munch, munch.
Sorry I'm late, guys. We've got a case of surfer's myelopathy here.
Where's your protective gear? You can't just storm in here like that.
This is a sterile environment, Hawks. You know better than that.
And what about the initial diagnosis of hypohydrotic ectodermal dysplasia? Are you sure about this new one?
Trust me, Frank. It's surfer's myelopathy, no doubts about it. We have the brave Antarctic icebreakers to thank for this one.
What's the prognosis, Hawks? Is it treatable?
Prognosis for surfer's myelopathy is not good. It's a progressive condition with limited treatment options.
But there must be something we can do, right? Any hope for the patient?
We'll do our best, but we have to prepare for a difficult road ahead. Just follow my lead, team. Tracy, I finally figured out the right diagnosis for the patient.
Great job, Hawks. I knew you could do it.
If I didn't have to deal with such idiotic doctors, this whole ordeal wouldn't have happened.
What do you mean by that? You were the one who made the wrong diagnosis in the first place.
Well, maybe my diagnostics team failed me this time.
Hold on a minute, Hawks. You can't just shift the blame like that.
I can. You know how that team of doctors nearly died in Antarctica? They trusted their bosses.
Hawks, I am so fucking sick of hearing about this documentary. It's the most brain-dead thing I've watched, apart from just about every case you've ever worked on.
I'm out of here.
Hawks, don't walk away from this.
I've had enough of this blame game. I'd say relations are icy, and there's no penguins here to save us.